Hi everyone, my name is Tatania. My presentation is on an 8-day-old female born at 39 weeks via VBAC with a birth history notable for fetal tachycardia that resolved shortly on its own. She discharged the hospital feeding and growing well. Since then, 2 days before the visit, the parents did notice that she had loose stools, about 8 episodes of these loose stools with no known triggers. The onset of the loose stools did line up with the mom switching from Similac to exclusively breastfeeding. Since the switch, mom did notice some regurgitation, some occasional fatigue, and falling asleep during feeds. The family has not yet connected with a lactation consultant. There was no fever, vomiting, or decreased urine output or respiratory symptoms. On exam, she's active and no distress. Growth parameters were appropriate for her age. Abdomen was soft, non-tender with normal bowel sounds. One exam finding was that she had white plaque or thrush noted on her tongue and oral mucosa. The three differential diagnoses that I considered was the oropharyngeal candiditis with secondary diarrhea. This is the diagnosis I chose. Second was transit cow's milk protein intolerance related from the switch from formula to breastfeeding. She didn't have any blood or mucus in her stools. And then the third one was a normal newborn stooling pattern, which is common for breastfed babies, but we end up going with the one associated with the thrush because the visible plaque. For treatment, we prescribe nystatin oral suspension, 100,000 units per milliliter, 1 ml by mouth 4 times a day, applied to the affected area. Nystatin is supported in the literature as safe, well-tolerated first-line option for the thrush, otherwise healthy infants. A randomized multi-center trial by Hope in 2025 conducted through the antifungal study group compared miconazole gel with nystatin suspension treating the thrush, and they found that the nystatin dosing was the best practice, and it's still used to this day for the first line therapy. Given that this infant is otherwise healthy and thriving, nystatin was the most appropriate. So, in short, 8-day-old infant with new diarrhea, temporary linked to the feeding transition, with the key exam finding of oral thrush pointing towards candida associated diarrhea as most appropriately explaining over allergy or any physiological pattern. The exam centered on nystatin, a simple supportive education along with close follow-up and attention, and the family paying attention to the feeding transition, along with access to lactation support along the way. Thank you.